Good afternoon. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, and we are here today to give a COVID-19 update. I'm joined by Dr. Geraldine Luna, one of the medical directors at the Chicago Department of Public Health, who will provide some remarks in Spanish after I provide remarks in English, and then we'll come back and take your questions. So the news continues to be very good here in Chicago, where we look at our COVID-19 outbreak, where we look at the progress we're making against vaccines. We'll start with some look at data. As always, this data is available on chi.gov/COVID-, and we've updated that spreadsheet and all of the data on it this week. You can make graphs yourself if you want to see what's happening in your zip code, how many cases were diagnosed last week, what vaccinations have been like over time. If you want to get a sense of what's happening by gender, by race, ethnicity, by age across Chicago for cases and vaccinations, that's all available for you to get down to the neighborhood level. But overall, if we look at our community risk matrix, all of our main indicators remain in the moderate or lower risk level. So we're currently averaging 256 new cases per day. Remember, that's still not quite where we want to be. We want to get that number under 200 cases a day, but it's down 17% just from a week ago when we were still over 300 and heading the right way. Our test positivity is at 3.0% test positivity. We have not seen numbers in the 250s or a 3% positivity since late February. So we're doing better than we've done in 3 months, and those have also continued to improve. The number of people hospitalized has been going down. We have currently a little bit under 300 people hospitalized with COVID across Chicago hospitals, and fewer than 15 Chicago residents getting admitted with COVID every day on average, down about 50% just from a week ago. And we have about 100 people, 107 on average, in ICU beds across Chicago hospitals. And you'll see that is actually also starting to get down toward lower risk. So even as we've made these movements toward reopening, we've continued to see improvement in our outbreak, and that's really good news. If we look at the overall graph, you'll see that the cases are continuing to decline. You can see, like I mentioned, we're getting down just to about where we were in February. We're almost down to where we were last summer, and we absolutely can get there if we keep making progress on vaccine. Our case rates are decreasing across all age groups. I did want to note that children, who of course are the least likely to be vaccinated, given that only children 12 years and up are able to be vaccinated, children do now make up our third highest rate of new cases here in Chicago. That's that dark blue line, and we'll post the slides online if you want to take a look. So we're still seeing the most cases when you correct for population, people in their 30s and their 40s, but then followed by kids 0 to 17. But it's not that we're seeing a surge in those children. It's just that vaccination has been working really well to help protect people in the older groups. And our new COVID case rates are still highest among Black Chicagoans, but they are decreasing. That's the purple line, and you can see that rate has been falling. The blue represents Latinx Chicagoans, falling very well, and then green are Asian Chicagoans, red are white Chicagoans. And the way that these case rates are looking is the inverse of how the vaccination rates are looking. So we've had more white and Asian Chicagoans at this point get vaccinated, and we're seeing lower case rates. We've seen in the middle, Latinx Chicagoans getting vaccinated, and we're seeing sort of middle case rates. And then at this point, not as many Black Chicagoans have been vaccinated, and we are seeing the highest case rates among Black Chicagoans. And if we look at this just over the last month by race ethnicity, you see this as well. We've had more than 4,500 COVID cases diagnosed in Black Chicagoans just in the last month. We've had more than 2,700 in Latinx Chicagoans, more than 1,800 in white Chicagoans, and more than 400 in Asian Chicagoans. But you can see that's showing over the month how each week those numbers were going down, and that's what we want to keep seeing. Also, if you look at a map here, you see that on the left, the darker blue represents parts of the city that have the highest case counts right now. You can see we're especially seeing that on the far south side. And then on the right side, the lightest blue represents the areas with the lowest vaccination rates. So you can see that the parts of the city where we're seeing the higher case rates, the dark blue on the left, are where we're seeing the lower vaccination rates, the light blue on the right. And it is those areas with the lowest vaccination rates that we're putting extra efforts in, as we're really working to make sure that we're making vaccine as accessible and convenient as we can for everybody in Chicago, but especially in the lesser vaccinated zip codes. January 17 marked the first day when the first Chicagoans who'd received the COVID-19 vaccine were considered fully vaccinated against the disease. So since January 17, we've had 4,830 COVID-related hospitalizations in Chicago residents. 98% of those hospitalizations were in people who were not fully vaccinated. Similarly, since January 17, we've had 618 COVID-related deaths in Chicago residents. 98% of those deaths were in people who were not fully vaccinated. I can't emphasize enough how well this vaccine is working. Here in Chicago, across the country, and around the world, we've given more than 1.7 billion COVID vaccinations at this point worldwide, not seen new safety concerns emerge, and seen better and better data every week about how effective this vaccine is, especially for preventing severe illness like hospitalization and death. And this is just one graph to show you in our skilled nursing facilities. These are our nursing homes in Chicago that have been by far the hardest hit from COVID. This is showing what cases look like in skilled nursing facilities from September through last week. The orange are COVID cases in patients, and the blue are cases in healthcare workers. And you can see that those red V's are when we came in partnering with pharmacies and did 3 vaccination clinics. And you can see as the first round of vaccination clinics, the second round of vaccination clinics, the third round of vaccination clinics came in, we suddenly saw all of those COVID outbreaks resolve. More than 2/3 of our nursing homes are now considered out of the outbreak. Almost half have not had a case in over a month. And the great majority of cases that we're seeing at this point are in unvaccinated healthcare workers. So the news is really good in our highest risk settings, but it's also really good across the city. Where we look at our Chicago vaccination rates, we have passed some milestones. 50% of Chicagoans of all ages have now received at least a first dose of vaccine, and 40% are fully vaccinated. We do see some disparities by race ethnicity here. 56% of white Chicagoans have gotten that first dose, and 56% of Asian Chicagoans. 42% of Latinx Chicagoans have gotten at least a first dose, and 34% of Black Chicagoans. If we just limit it to adults, we've now crossed the 60% mark. We're at 62% of Chicagoans over 18 have gotten at least a first dose of vaccine. And again, 50% of our adults here in Chicago are fully vaccinated. We're hoping to get to the point where 70% of adults have gotten at least a first dose of vaccine by the 4th of July. That's a national goal that's been set. It's a goal that we've also set here in Chicago. And I'm happy to say, finally, that we've hit the 70% mark for Chicagoans over 65 that have gotten at least a first dose of vaccine. We've been working on that for months. We're still not done. The biggest risk factor for severe illness for COVID is age. And so if you know anybody over 65 who's not yet vaccinated, please, please, please help them get vaccinated. But we're happy to have finally hit that 70% mark. If we look at our 7-day rolling average of first vaccine doses, we're doing between 14 and 15,000 doses of vaccine every day here in Chicago, which is good. If we can maintain that rate, we would expect to hit that 4th of July mark, and we've been pleased. We certainly saw some decrease down from April, but then it steadied. Much of this has been in children, and on this graph, what you see is between March, April, and May, again by age, that blue line is children. And so you can see that the rates of vaccine obviously were very low until April, when vaccine became, when 16 and 17-year-olds became eligible. And then you see that sharp uptick on May 13 when 12 to 15-year-olds became eligible. We vaccinated thousands of children. It's been going really well, and I highly, highly encourage you to get your kids vaccinated. So as a reminder, here in the city, vaccination is open to anybody age 12 or over. There are lots of appointments available. You can go to ZocDoc.com/vaccine. You can also go to chi.gov/covidvax if you want to see what's near you. But also, there is no appointment needed at any city site. So you can walk in, or you can walk in to Chicago State University. You can walk in at Kennedy King, at Daly, at Wilbur Wright, at Loretto, at Apostolic Faith Church. You can also call 312-746-4835. And really, I want you to hear this number because this is what I want to share. 312-746-4835. There are about 200 people answering that phone, so there is not a long wait. We are open 7 days a week, and we will handle whatever your problem is related to a vaccine if you're a Chicago resident. You want a particular kind of vaccine. You have a question about your first versus your second dose. You want to know where vaccine is available near your house and when. You want to help with an appointment. You want to make sure there will be interpreter services available. We will get you a vaccine if you call that number. Protect Chicago at Home, we announced last week, was really an expansion of our ability to bring vaccine to our most vulnerable residents with no barriers. So you'll remember we started with homebound Chicago, people who had medical reasons and had difficulty leaving home, and we've been working with Chicago Fire Department, with partners, even with volunteers to bring vaccine to those folks. Last week, we opened that up. We're now calling it just Protect Chicago at Home. Anybody age 65 or older who lives in Chicago, or anybody with a disability or a medical condition that makes it hard for them to travel, call our number. We will book you an appointment and bring you a vaccine to your house. We'll bring Pfizer, we'll bring J&J, we'll make it happen. We had about 264 appointments booked in less than our first week citywide across all regions of the city, actually the most from both the far south and the near south, which we were pleased to see, and there are plenty of appointments still available. So again, 312-746-4835. No excuses, we will figure out how to get a vaccine for you. Free, available, safe, and absolutely the way to best protect yourself. I just want to highlight our mobile vaccination efforts are continuing. You can see they're really all over the city. On the left, you can see the most recent vaccine events through May 15th, and on the right in green, these are the ones that we have upcoming over this next week. And if you look in detail, you can go to chi.gov/covidvax. But in addition to all of the hospitals, clinics, the Chicago sites, the pharmacies that are vaccinating, this week alone, we are doing 48 pop-up events, either with the vaccination station, which is our COVID bus, setting up at the schools, doing things at farmers markets, doing things at churches, doing things at CTA stations, food pantries, really working to bring vaccine to you. So you can go. There's a day-by-day calendar. There's a map. If you really want to come and have the opportunity to get a vaccine in a way that's very convenient in places that folks are going already. And I do just want to give a shout out to some of our churches who have really been stepping up. We know that to reach seniors, church can be a good place to do that. And last Sunday, we were at New Life Covenant Southeast, Fellowship Missionary Baptist Church, Maternity BVM, St. Philomena, St. Francis, and Christian Community Church. And we're doing 50 to 60 or even more vaccinations at each of those sites, which is a really good turnout, especially when a lot of those folks are older. So we're really working to bring vaccine where it's needed. And if you have a group that you've got a list of people who want to get vaccinated, let us know, and we'll work to bring vaccine to your event or your location. Quick update on the city sites. So yesterday, we completed our successful engagement at the United Center. The federal support team left yesterday, and we really want to thank them. We had an initial 8-week plan, and it was so successful, we extended that another 3 weeks, have given more than 287,000 vaccine doses at the United Center, not even including some of the doses that came in for the region around it, and provided translation services to more than 55,000 people who got vaccinated at the United Center. The United Center drive-through remains open for 1 more month until June 24th. I drove through yesterday just to take a look at it. It's fast. You're in and out typically within half an hour. People will answer your questions. You don't have to get out of your car. And we've got both Pfizer and Johnson & Johnson available. Again, free, no insurance or documentation. You can make an appointment on ZocDoc.com/vaccine, but it's not required. You do need to come by car. And starting this weekend, we will be offering free Six Flags tickets available for anyone and their family, up to 5 total, anyone coming for a first or a second vaccine dose at any of the city sites. So that includes the colleges that I mentioned earlier, Chicago State University, et cetera, and at our vaccination station, the Vax Bus. So if you see the Vax Bus, certainly go and get vaccinated, but also please feel free to come pick up some Six Flags tickets. And big thanks to Six Flags and the governor's office for helping to organize that. Our strike teams are still out, meaning that's where we go to higher risk settings. We've got 13 events this week. We're at our HUD low-income housing, HUD senior housing. We're at the community integrated living arrangement housing sites, other supportive facilities, and SRO congregate housing. And thanks to the many, many partners helping make that happen. And then the Vax Bus. It's been one of our most popular things. You can go online and see, but just over these next few days, to give you a sense, we'll be in South Shore tomorrow at the Atlas Senior Center from 10 to 2. We'll be in Englewood on Thursday at the Red Shield Salvation Army from 9 to 1. We'll be in Roseland at Chicago Cred, noon to 4. And then Friday, we'll be in Austin at the North Austin Library, 10 to 2. Please get on social media and tag #ProtectChicago to tell us where to bring the vaccination station next. If you've got an idea where people are gathering, we're looking at that. We're getting a lot of good leads. We want to send this bus where you are and where it's going to be easy for you. So let us know if you've got a good idea, and we'll give you a shout out if we use your idea for the vaccination station. And finally, we're excited to be doing some of our Vax and Relax events. It's Official Barbershop in Englewood on June 5th from 10 to 2 is going to be open. You can get a free haircut or a gift card for a haircut. Josephine's Jet Set Hair Salon on June 12th down in South Shore will be open 10 to 4. They're not doing haircuts on site there, but they're going to provide a voucher or a gift card for all salon services. We're making those Six Flag tickets available there. And again, big thanks to all the neighborhood businesses that have been helping to support and really promote vaccination at their sites. And with that, I will turn it over to Dr. Luna for some comments in Spanish and then come back. All of these efforts are part of our Protect Chicago initiative, and then Protect Chicago Plus has continued. That's where we are pushing vaccine to those under-vaccinated areas. All of these hyper-local focus are our Protect Chicago Plus efforts. So we're making good progress, and with that, I'll hand it to Dr. Luna.
Thank you. Thank you, Dr. Already. Muy buenas tardes a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y tenemos muy buenas noticias. El Departamento de Salud Pública de Chicago está organizando docenas de eventos especiales de vacunación contra el COVID-19 para toda la ciudad. Esta semana y durante el fin de semana del Día de los Caídos, o lo que se le conoce Memorial Day. 48 eventos ocurriendo, con un enfoque continuo en las comunidades donde la cantidad de vacunas sigue siendo baja. Un calendario completo de ventanas de emergentes y eventos especiales se encuentra en nuestro sitio web de la vacuna de la ciudad, chi.gov/covidvax. Ahí van a estar todos los eventos publicados. Anímense, son eventos familiares, lléguense en familia y vacúnense. El esfuerzo es parte de Protege a Chicago Plus, una iniciativa que inicialmente se enfocó en 15 comunidades de alta necesidad, según el índice de vulnerabilidad de la ciudad, para asegurar que una parte significativa del suministro de vacuna, en aquel momento muy limitado, fuera a las áreas de las ciudades más afectadas por el COVID-19. Como resultado del Protect Chicago Plus, desde principios de febrero hasta principios de mayo, las personas con al menos una dosis de la vacuna contra el COVID-19 de las 15 comunidades iniciales pasaron del 6% a casi 50% en vacunación, lo que fue posible en parte gracias a 124,000 dosis asignadas a las clínicas temporales de Protect Chicago Plus y en estos eventos especiales que están ocurriendo hoy en día. Además de eventos especiales, la ciudad anunció recientemente la expansión del programa de vacunación en el hogar, llamado Protect Chicago at Home. Significa protege a Chicago en su hogar. Cualquier persona de 65 años o más, o cualquier persona con discapacidad o condición médica ahora es elegible para recibir la vacuna en su casa. No tan solo usted, pero toda su familia. Estas personas pueden llamar al 312-746-4835 y repito, este número es muy importante. 312-746-4835 para programar una cita o para hacer cualquier pregunta que necesite para vacunarse, cualquier tipo de contestación de qué le queda más cerca, qué tipos de vacuna, la preferencia de su vacuna, si la quiere recibir en su hogar, si la quiere recibir en alguno de los lugares donde las citas para recibirla en nuestras clínicas de la comunidad. Toda la información que usted pueda requerir o necesitar la encuentra aquí. Más de 200 personas están contestando teléfonos 7 días de la semana. Todas las vacunas COVID-19 se ofrecen sin costo. Recuerden, no se requiere seguro ni identificación ni cita para recibir su vacuna. Para obtener más información, otra vez, visite chi.gov /covidvax o llame al número 312-746-4835. Y ahora en un tono más positivo aún, 2.5 millones de personas aquí en Chicago ya han recibido la vacuna, por lo menos una de las dosis y están en una serie de 2. La seropositividad se encuentra en el nivel más bajo desde febrero. Así que vamos en buen camino y todo gracias a las personas que ya han recibido la vacuna. Los casos están en 256 por día, bajando de riesgo moderado rápidamente a riesgo bajo. Así que tenemos que seguir vacunando y protegiéndonos a nosotros y a las personas a las que amamos para poder seguir bajando esta pandemia y la seropositividad. En el intensivo tenemos 107 casos que también ha disminuido y la mortalidad ha bajado a 5 casos. Estas son todas muy buenas noticias. Desde enero 17, que nuestro primer caso de vacunado, como se recordarán, fue la doctora Marina del Río, una latina, recibió su vacuna. 4.830 casos han surgido desde ese momento de COVID-19. Y de esos 680 han muerto. Hacemos el énfasis que 98% de estos casos positivos y las muertes fueron en personas no vacunadas. 50% de los miembros de las comunidades de Chicago ya han recibido por lo menos 1%, una dosis de la vacuna en una serie de 2 o recibieron la dosis de J&J. De esos 56% son caucásicos, 56% asiáticos, 42% latinos y 34% afroamericanos. Todavía vemos disparidades. Es importante seguir esta iniciativa de vacunarse. 62% de las personas mayores de 18 años de edad en adelante ya han recibido por lo menos una dosis de la vacuna y 50% se encuentran completamente vacunados. Vamos por buen camino, pero las vacunas sobran. Todavía tenemos que seguir acercándonos y recibir esa vacuna si no la ha recibido y recíbala en familia. 70% de las personas vacunadas en Chicago tienen 65 años o más. Estamos alcanzando los niveles nacionales, que son 87%. Vamos en buen camino. Si conoce a alguien de 65 años que no ha recibido vacuna, la puede recibir hasta en su hogar. Esa persona de 65 y toda la familia. Así que anímense todos, sigamos este esfuerzo colectivo de vacunación, vacunémonos todos, protéjase así a las personas a las que ama y por ende a sus comunidades. Gracias.
Thanks, Dr. Luna. Happy to take questions.
Dr. Irwin, kind of a little bit off topic, but, sorry. There is a bill right now pending in Springfield, and it would give homeless shelters the same status as medical centers. They had a tough time during this pandemic. They weren't at the top of the list. They weren't considered healthcare workers. They had to wait for the vaccine. Of course, they'd like to get in on some of that federal relief as well. Where do you stand on that? Do you think that's a good idea? Do homeless shelters and organizers deserve that same status?
So I have not read the details of the bill, so I'd want to do that to weigh in officially. But I can tell you that we certainly here in Chicago actually did prioritize homeless shelters very, very high in terms of all of our efforts related to COVID vaccine. It was actually right after the skilled nursing facilities, right when we started going to other senior facilities, right away there. We started with homeless shelters too. It was the very first group that we did. We also worked here in Chicago, as I think people know, with Department of Family and Support Services, All Chicago, and so many others to shield people who were experiencing experiencing homelessness. So not wait for them to get COVID, but in turn space people out, really help house people at the hotel. Lawndale Christian and others provided a lot of that really important on-site service work to then move those folks into permanent supportive housing. And we've used the opportunity from COVID to actually embed primary care now in homeless shelters. So CDPH used some of the federal COVID funding to fund this kind of work. And so, one thing I would say is that we think it's a best practice to have primary care available in homeless shelters, and then that helps, it's even better than sort of making a status, is actually having that kind of care available. And so it's certainly something we plan to continue to support. I can tell you at some of the largest shelters here in Chicago, after we've, helped support some of this, we've seen a big decrease in the number of ambulances, even the number of, police calls that are coming. People are able to get the medications, the access to mental health care, because there's been a big focus on behavioral health care at the same time. So I'll look at the details of that bill, but I would broadly say that it's important to think about the access for health care for people who are in homeless shelters, and certainly we're supportive of making sure that they can access resources.
Thank you.
Given that the United Center will wind down and you have all these local community efforts, what would you say is the future of mass vaccination pods in Chicago? And if they will also wind down, how come?
Yeah, it's a great question. Did you say how often?
If they will also wind down, how come?
Okay. So this is really our natural progression when we're thinking about COVID vaccination. And interestingly, we had these plans for thinking about our pandemic response really from the beginning. And where you step all the way back to even before COVID got here, even in those plans, you think about starting with mass vaccination or mass treatment, and then eventually moving to smaller efforts. That's how large vaccination efforts work. And so certainly the United Center has been our largest mass vaccination site by far. And that site at some points was doing 5,000, maybe even 6,000 doses in a single day. We don't have that kind of demand at this point. Typically where we're doing events, we're doing a few hundred. You heard me mention at these churches, when we're doing 50, 60 in a community setting like that or in our bus, we're very pleased with that. And that means that we don't need to staff up the hundreds of staff it takes to make sure you can efficiently move hundreds of people through a mass vaccination site. So what we'll be doing is transitioning a lot of the staff and the efforts and the vaccine from many of these larger sites to the community sites, like you heard, and then also continuing to support providers. If you think about where you get a flu shot, typically, we're kind of moving into the flu shot stage of this, where it's not, can I find a flu shot? You can get a flu shot at your doctor. You can get a flu shot at your pharmacy. You can get a flu shot through the Chicago Department of Public Health, but you don't go to a site where thousands of people are getting vaccinated. So I do expect that really over the next couple of months, we will be, turning these down and turning them off. We will continue to obviously maintain free and accessible vaccine for everyone, but this is the natural progression and we welcome it. It gets harder every vaccine we work a little bit harder for at this point, but it also means often that we're vaccinating people who perhaps most need it or were a little more hesitant at the beginning. So a little more resources. We won't see the numbers increase quite as much, but as long as they continue to increase, especially in under-vaccinated areas, that's really where the money is.
Do you have the exact doses given at the United Center and the racial breakdown?
We could provide that to you. The overall doses I know have been in the 180,000 range, give or take. And if you want to follow up with us online, we can get you the racial breakdown.
Okay, thank you.
Hi.
Hi.
I'm interested in that risk matrix illustration that you have.
Yep.
Is the goal to get every matrix into the green column at some point? I'm just wondering what your perspective is on it.
Sure. So in this, I'll just pull it up so everybody can see what we're talking about.
Really good illustration.
Yeah. So
because it says controlled transmission.
Yeah, exactly. Yeah. So this is really getting at the fact that we are unlikely to eliminate COVID. And so there's been some work around the country to think about what does it mean to be fully controlled from a COVID perspective. And this was our attempt to really put some numbers on that here in Chicago. Ideally, we would be in that green range, but we don't need to get to the green range to be able to be fully open, for example. I would be very happy if we could move everything into that lower risk phase. But even while we're in the lower risk phase, that doesn't mean controlled controlled transmission, that doesn't mean low risk. We use lower. And really this controlled transmission, if we were at a point where we were seeing fewer than 20 cases a day, test positivity less than 2%, fewer than 100 people in the hospital, fewer than 20 people in the ICU, that would be at a point where I would expect that's about as good as we would get from a COVID perspective. So we wanted to set a controlled setting that we could kind of aim for, and it's been part of a larger conversation. And then, if things are all looking good in the summer, of course, we continue to aim for this. But we don't need to be in green to be fully open, and really getting everything to blue is our primary goal at this point.
But your expectation is no longer, or is not, that we would be in the green column in Chicago?
Oh, I'm hopeful we'll get to the green column at some point. I don't know when, but I'm hopeful that we'll get to controlled transmission. Certainly if we get even more people vaccinated, right? And there's less and less opportunity for this to spread. Our goal is to get there. I don't know for sure if or when we will, but we felt like it was important to set, that sort of ultimate goal, because people tend to think in black and white, like there will be all COVID or there will be no COVID. And I don't think we'll get to a point where there's no COVID. But for people who are vaccinated, the risk is already low, and it will get lower and lower and lower as we move to the right there. And if we're in controlled transmission, it would be essentially zero.
I've got two more questions, but just on that point, I'm curious. Have you spoken publicly about, the New York Times had that report, I think, at the beginning of the month about the fact that we're no longer thinking, or epidemiologists aren't really thinking about COVID in terms of herd immunity anymore. I'm not really sure if you've spoken about that at a podium yet or anything, but have you? I'm not sure.
Yeah, sure. I feel like I speak about herd immunity a lot, but I'm happy to talk about it. So herd immunity for me is one of those things that is also not black and white. There is not a magic number that we say suddenly we go from the point that everybody is at risk of COVID to nobody is at risk of COVID. The basic idea of herd immunity or population immunity is just that there are enough people protected against COVID with the vaccine or from natural immunity that when someone gets COVID, it doesn't have anywhere to spread. So where we think about measles, for example, about 98% of our kids are vaccinated against measles. So when a case of measles pops up in Chicago, we certainly do a lot of contact tracing around it, but we almost never see it spread unless it's in a highly unvaccinated population. Like if it gets into a daycare, we see it spread very, very widely because children under 1 can't be vaccinated. So there's not one magic number. And in fact, the estimates have increased a little bit because of the emergence of variants, right? Where we started thinking, maybe a 70% vaccination range. When a virus is more contagious, it means you have to have more people protected to help protect everybody. And the idea of population immunity is that even people who are not vaccinated then would have some level of protection. So I think the 70% goal of adults having gotten a first dose by July 4th is a good goal. It's a little bit of a stretch goal for us and for the US, but I think it's doable if we keep making progress. It doesn't mean, though, that will be the end of COVID, and we will certainly keep working on vaccine. But every single vaccinated person gets us one step closer to the point where we have more protection as a population.
Two more, and I'll try to be brief. I'm interested in the 2% positivity there in the green again. Working where I work, I keep track of the zip codes on the Mid-South Side a lot, and the two for Bronzeville and Northcote, and for South Shore, they've been hovering for the last several weeks or months between 4 and 6%. Yep. I'm wondering, now that we're going into summer with seasonality and also with natural immunity and with vaccinated immunity, are we going to see these going down? Is there any kind of modeling for what we would expect in these higher positive zip codes, especially ones in black neighborhoods on the South Side and West Side and that kind of thing going forward in Chicago and that kind of thing?
Yeah, it's a great question. So I never look at positivity by itself. I always look at positivity along with cases, because you could have a very, a high or a low positivity. You also have to, you can affect the number of cases you diagnose by the amount of testing. So we have seen consistently higher, as you know, positivity, especially on the far south side right now. There are just more cases there. And actually, we've been directing additional testing resources in mobile ways all along. We've done that through COVID, but right now we've been doing that, especially on the south side, because it helps to get more folks vaccinated, helps to kind of stop the spread. I remain very optimistic that we will see these numbers continue to decline. They are decreasing across all race ethnicity groups and all ages, although, as you note, the highest positivity and the highest highest cases and the highest hospitalizations and the highest deaths do remain in heavily Black neighborhoods, and that's where the lowest vaccination rates are. So while we're working to bring more vaccine and decrease those barriers, also working to bring more testing, and that will also help to decrease that positivity, but more importantly, get people diagnosed.
And I mean, the last question I've got is still, I mean, the vaccination rates in these two zip codes that I mentioned, but a lot of the predominantly African-American zip codes on the south and west sides are still 20 percentage points lower than places on the north side, even, you know, zip codes in Hyde Park and that kind of thing. I mean, you've outlined some things here, but I mean, is it just going to be a slow, steady chipping at getting more and more, you know, people day by day vaccinated? What's the end goal as far as CDPH is concerned?
Yeah. Yeah, absolutely. So, you know, I mentioned that our overarching goal, matching the country's goal, is to try to get to 70% of adults with a first dose by the 4th of July. But there are already some zip codes that are there, and as you note, there are some that are far from there. And so it's not just that goal. You know, we've really, you know, I am more interested in seeing improvement in our highly under-vaccinated areas. That's really our top goal with this equity lens. And so we are doing a lot in the least vaccinated neighborhoods. We're taking the same approach that we did with testing. Wherever we saw, you know, outbreaks surging, that's where we'd push resources. We're doing the same thing. And so, you know, we'll be talking in some more detail about this over the next couple of weeks. But we're doing efforts where we're literally knocking on all the doors in under-vaccinated areas. We're bringing the bus. We're working to bring vaccine. And, you know, when I've been out with the bus or when I've been out at some of these events and, you know, talking to the folks who come to get vaccinated, most of the time people are actually talking about convenience still. They're not talking about a lot about, you know, I was really scared to get the vaccine or I was really against it. It's more like, you know, I had to work and I couldn't get it, or I wasn't sure where to get it, or there are still some people who think you have to pay for it or you need insurance. And so I've been very encouraged when I've been out at events all around the city that there are still a whole lot of people out there who want to get vaccinated, but it's just not first on their list of things to do. So if you actually look at what's been happening week by week, 60% of our vaccines last week went to Black and Latinx residents. And we've been seeing the biggest increases in Latinx especially, but in Black residents too. And so we're at this point actually last week, you know, we vaccinated more Latinx than even white Chicagoans. And you saw, you know, the Asian Chicagoans are now actually matching the white Chicagoans, which is new. And we're making progress. That's what I can say. And really trying to do everything we can to support providers, get questions answered, you know, and raise community voices. I think these church efforts are also have the potential to be important and good, where we're actually, you know, partnering with pastors to have conversations about vaccine and then make it available on the spot. But you know, it does get slower when we get to this point, but that's to be expected. And, you know, we don't think it's good enough just to sort of get the city overall there. We want to, you know, I want to say Englewood, come up out of there. We are at, you know, we've hit some milestones there too, but we've got a ways to go.
Thank you.
Thank you.
We're all satisfied with the racial equity data from the United Center? Did it do its mission?
Yeah, so we've been very, very pleased with the United Center, and so has the federal government. So let me take you just a quick reminder about the United Center. So when it first opened, you might remember, it was open actually to everybody in Illinois. Because this was a joint project with the federal government, the state, the city, the county. And so right from the beginning, it was open to anybody over 65 across Illinois. But we saw by far the largest number of people coming from outside Chicago, people driving a long distance. I mean, this was quite early when it was harder to get vaccine. And, you know, the federal government, FEMA, was really wanting to be focused on making sure vaccine could get to parts of the country and then parts of the cities within those spaces where there were more barriers. And they had actually set some goals of making sure people who lived in what we would call a high COVID vulnerability index got vaccinated. And so after that first data, we worked, you know, with the federal, with the state, and basically limited, you know, said we're going to actually just limit access to the United Center, you know, in the public way to Chicago residents, and then we made some available to suburban Cook residents as well. We set a little bit off for some of the areas outside Chicago, but we really turned our effort at that point to making sure that first priority went to people coming from less vaccinated zips near the United Center. And it was hugely successful in that. Like if you look at the 60608, for example, which is the area where Pilsen is, just south of the United Center, like opening up the United Center to that community got that area at that point like as vaccinated as the North Side. And we saw people really, coming from across the city, including from some fairly southern parts of the city to get vaccinated. So I don't have the full numbers in front of me, but overall, I can tell you this was one of the most successful really sites in the country as far as getting vaccine into the communities where it was most needed. It's part of why it was extended. And I think particularly where you peel off some of the suburban and state and really focus on the Chicago work, I think it's been very successful. It was also very good for a lot of the Asian Chicagoans, Chinatown. A lot of folks got vaccinated there too, and we saw a lot of 55,000 language requests. In a lot of ways, is one of the things I'm the most proud about when I look at the work that team has done, because that tells me that it wasn't just the obvious people maybe coming to get vaccinated, that message was getting through across all communities. And when I was there yesterday, even they still had on-site interpreters for 5 or 6 different languages, and really worked hard to make sure people with disabilities, et cetera, we thought about how to make this as accessible as possible. So I think it's been a really good lesson for us in terms of how to do a lot of vaccine efficiently and quickly without giving up on equity. And we'd be happy to follow up with the exact racial breakdown for you. Okay. Yep. All right, thank you.